A quick disclaimer before we begin, the PEMF podcast does not contain any medical advice, and the content provided is for informational purposes only. If you have any health concerns, please visit a healthcare professional.
Welcome back to the PEMF podcast. Today, we're going to be talking about all things women's health, all the way from period cramps to cancers. We're talking about how you can apply PEMF for these, how PEMF can actually help these, and we'll include some studies along the way.
So all these topics really is a huge reason why women are going to use PEMF. I should probably put another disclaimer into this episode to say that I don't claim to be a women's health expert. I don't think any man on this planet should make that claim, but I recently featured on an Amazon Prime documentary called Shield, which should be out this summer, hopefully. So if you want to watch that, it'll be out in the summer. But during that process, I was interviewed and I had to do a lot of research around PEMF and women's health. So hopefully we've got quite a lot of knowledge we can share with you guys and we can talk about that on this episode.
Brilliant. And just for anyone who's might be this first episode or first time I've heard about PEMF, just what is it in a nutshell?
So yeah, PEMF in a nutshell stands for pulsed electromagnetic field therapy. It's all about creating a magnetic field around the body, creating the ultimate environment to heal, reduction of inflammation, reduction of pain.
So we'll kind of start with more pain-related stuff. So maybe we start with menstrual cramps. How can PEMF maybe help reduce the pain that people might be feeling while they're going through that? Can it? And how can it?
Yeah, so really on the pain side of things, PEMF therapy can help reduce inflammation. It can help increase circulation in a certain area of the body. And that in turn can reduce the amount of pain that a woman could feel either during a menstrual cycle or just in general. There was one really good study we found on this and included 40 women aged between 20 to 30 with primary dysmenorrhea. For those of you who don't know, because I didn't know what that meant to start with, essentially it's a medical term for like an extreme period cramps. These women were selected randomly, divided into two equal groups. Group A received PEMF treatment 3 times a week for 3 months, with each session lasting around 30 minutes, in addition to standard medical treatment. So they were using it alongside as a complementary therapy. In contrast, Group B, the control group, received only standard medical treatment. So specifically NSAIDs. So that's a class of medicines that are used for reduction of pain, fever and inflammation, like ibuprofens, those sorts of things. The research assessed menstrual distress and pain using a menstrual distress questionnaire, which is known as a VAS score or visual analyze scale, before and after the treatment of both groups. So the VAS scores demonstrated a significant difference after the treatment, favouring the PEMF group, which is amazing to see. Similarly, the menstrual distress questionnaire, the results of that, the menstrual distress questionnaire also reflected a significant reduction in symptoms from the PEMF group compared to the non-PEMF group.
And yeah, and if you want to find that study, that is available on our Instagram as well, along with loads of other PEMF studies and loads of other PEMF kind of information as a whole. But another thing that a lot of women do kind of struggle with is endometriosis and fibrosis. Can PEMF help with this as well?
Yeah, sure. So PEMF therapy can really help with those conditions. Especially endometriosis, where there's a couple of ongoing studies at the moment, one in Italy and one in Germany that we know of at the moment. They're not concluded yet, but they're already showing some really good signs of improvement. They're using low intensity, localized devices that you can wear. You can wear them for longer periods. So you can wear them for like up to an hour. And improving the circulation in the area and reducing the inflammation, because endometriosis effectively is an inflammatory disease, is really going to help with the symptoms of those conditions. So yeah, PEMF therapy is definitely one to look for anyone trying to manage the symptoms of endometriosis. Something that's also quite close to my heart because I know a couple of people within my family suffering with this condition and are using PEMF therapy to alleviate the pain.
Women suffering from these conditions as well, they also tend to get a lot of pelvic pain. Is this something PEMF can also benefit them for as well?
Yeah, so we always say that PEMF therapy isn't condition specific, so it's not going to target the pelvic specifically. But again, if you can reduce the inflammation in those areas and increase the circulation, the natural healing is going to happen. Within that same area, pelvic floor is also something that women suffer with when it comes to like incontinence. We know of a lot of high intensity devices that are used to strengthen the pelvic floor, because high intensity you can feel, you get contractions in the muscle, and essentially it's like a exercise for the pelvic floor. If you do like a 10 or a 20-minute session, essentially sitting on a high intensity device. There's a few out there that are like chair applicators, or you can just get a pad that the women can sit on to assist with the pelvic floor. And as I say, that tends to be a much higher intensity device. But looking in this area, so there was a really, really good study that I found when it comes to a low intensity full body systems. And the reason I want to mention this one is because it showed how the healing phase using PEMF therapy was basically halved. And what they did to get this study, because if you're looking at people with cancer and that sort of thing, it's hard to get human subjects. This particular study was looking at postpartum women after childbirth. Something that can be damaged after childbirth is the perineum. Quite often, sorry about this, but sometimes that tears or medical intervention has to get involved and they cut the perineum. So there's a healing process that comes after that. And obviously, subjects for that are quite easy to find because there's lots of women giving birth and there's lots of people with damage to the perineum after childbirth. So what they actually did with this study was they took a group of these women and they had two groups. One was treated with PEMF, the other wasn't. They took the more conventional kind of healing terms through the normal medical terms. And what they did was they put them on a full body mat, and that was a low intensity device. So this device was around 2 to 3 Gauss, so quite a low intensity device. They were using that twice a day for 20 minutes. So this is once they've been discharged from hospital, they went home, they took a full body mat with them, and they treated themselves twice a day for 20 minutes. The study showed that 100% of the women that were treated with the PEMF devices actually had a reduction time in the healing phase. So they actually healed much faster than the women that weren't treated with a PEMF. The other factor they were actually looking at was sexual dysfunctions. Obviously, when women have just had a child, they're not ready to go back to the bedroom and have sex again. But what this study showed was that 87% of the women that were treated with PEMF were ready before the group that weren't. So again, it just showed that the healing phase was quicker. And that's not just women that are postpartum, that's women or even just humans that have had surgery. These studies can show how PEMF therapy can speed up the healing process. I mean, it would be amazing if we could get this technology into the NHS, because one of the biggest problems with the NHS is that they don't have enough beds. Beds are unavailable, should I say. If you can get a PEMF device, just a low intensity device on the beds, within the beds, then you can treat them people after their surgery. You can get them out of bed 50% of the time, within 50% of the time. That frees up the beds. That should cure some of the issues in the NHS. But trying to get the in seems to be the problem these days.
Yeah, no, definitely. Hopefully soon you will see more kind of PEMF in the NHS setting or in more kind of hospital settings. But kind of in a similar kind of vein or similar area, postmenopausal women often suffer with osteoporosis. Can PEMF help them with their healing? Can it help them with their bone health and all kind of stuff like that?
Yes, we've done a whole episode on this. If anyone who wants to hear more about PEMF and osteoporosis, switch it back to episode 42. But as you say, women, especially postmenopausal women, are at a much higher risk of osteoporosis, and that's due to a decrease in estrogen levels. PEMF therapy can help stimulate the bone growth, improve bone density, and potentially reduce the risk of fractures. And that's because it's enhancing bone regulation and cellular activity. So PEMF's first FDA approval was in 1979, and that was to help heal non-union fractures. So a non-union fracture, if anyone doesn't know, is a fracture that just won't heal on its own time. So this study was showing kind of like a little bit about PEMFs and bone healing and the ability of applying PEMFs for that healing process and actually getting those non-union fractures to heal. But going back to osteoporosis, there was a study done on postmenopausal osteoporosis in Southwest China. In this study, 44 women were randomly assigned to either alendronate, a commonly used medication for treating postmenopausal osteoporosis, or alternatively using PEMF therapy. So they had two different groups in this again. The main goal of this study was to see how these treatments affected bone density in the spine and hip, as well as vitamin D levels, muscle strength, and balance over a 24-week period. So the results of this showed no significant difference between the two groups in improving bone density, muscle strength, balance, and vitamin D levels. So that suggests that the PEMF treatment is just as effective as a commonly used medication, alendronate, for PMO over the 24-week period. So, what we're saying there is that we've got a well-known medication that is used for postmenopausal women for osteoporosis, which has a really good effect. We apply PEMF therapy instead of that medication, and we're getting the same results.
And yeah, once again, that study will be available over on the Instagram if you want to go check it out. But kind of now moving subjects, kind of moving more away from physical issues, maybe more towards mental issues. Can PEMF help balance hormones, and kind of how might it do this?
Yeah, so PEMF therapy may help in balancing hormones, and that's done by improving the communication between the cells. So you can support the endocrine system and promote overall cellular health using PEMF. This can be especially beneficial during menopause or in women dealing with conditions such as polycystic ovary syndrome. So that's also known as PCOS.
One thing poor hormone regulation to lead to as well is kind of bad mental health, kind of stress, anxiety, depression, all those kind of things. Can kind of PEMF help regulate moods and help people who are suffering with stuff like that?
Yeah, especially stress and anxiety. PEMFs have been shown to reduce cortisol levels, especially when it comes to managing stress, which can be particularly beneficial for women who face kind of higher stress levels. PEMF therapy may also promote relaxation and improve sleep quality, contributing to better mental health. So when it comes to mood regulation, it can help by stimulating the production of serotonin and other neurotransmitters. So PEMF can help improve mood and potentially reduce symptoms in depression and anxiety. So it also kind of depends what device you've got and how you're using it. But because when it comes to stress and anxiety, a lot of the time you will see devices that are transcranial PEMF therapy systems, and that means applied to the head basically. So you can get higher or low intensity devices that are applied to the head, and that becomes a little bit more important when it comes to applying the frequencies, because the frequencies can help balance the mood, assist with circadian rhythm, and really help with stress levels. But what we also find is that people that have a good full body system tend to use it as downtime. So if using a full body PEMF mat and using it first thing in the morning or using it last thing before bed, using it on the right frequencies can really help with stress levels, and it can give you that time to reflect and to relax, to recharge. Literally everything we kind of promote is all about getting yourself some time while using those PEMF devices. So there's no, with like an ice bath and that sort of thing, you're raising stress because it's quite, it's a stressful type of therapy to use. PEMF therapy is a passive therapy. So you can literally do it in front of the TV. You can do it when you're meditating. You do it when you're chilling. So again, it's just that time to switch off, get a session in, and, regulate your mood and your balance doing it that way.
Yeah, great. And moving kind of now onto more serious physical conditions, kind of like cancers and stuff like that. Breast cancer is one more specific to women, as only about 1% of cancer diagnosis, breast cancer ones, are for men. Has there been any research showing that PEMF can help with breast cancer?
Yes, there was. And currently anti-cancer therapies such as gamma radiation and chemotherapeutic agents induce cell death and cellular senescence, which for anyone who doesn't know is a state in which the cell stops dividing. So cancer cells stop spreading basically. So not only in the cancer cells, but also in the adjacent normal tissue. So they studied how breast cancer cells and normal cells found in connective tissues reacted to PEMFs. The PEMFs were applied at a frequency of 8 Hertz and the intensity of around 100 Gauss using a square wave device, and applied this twice daily for 5 days. The data collected showed that the application of PEMF decreases the proliferation rate. So that's how quickly the cells multiply or reproduce. And the viability, their ability to survive and function normally. of those breast cancer cells, while having the opposite effect on the normal fibroblasts. So additionally, the PEMF induces cell death and cellular senescence only in the breast cancer cells without any effect on the non-cancerous cells. So it even shown to be better than some traditional treatments out there at the moment. So I want to make it clear that the kind of research around this is still quite limited, but the initial findings are looking really, really promising.
Okay, so putting the cancer aside, what about just kind of overall breast health? Can it help with that?
Yeah, absolutely. PEMF therapy has been explored for its potential to reduce inflammation and promote overall breast tissue health. So there's some studies that suggest it may help with the healing of breast tissue after surgery or any other treatments. But one of the most recent Instagram posts showed a study from people using PEMF therapy after breast reconstruction. And they found that to have less pain, less inflammation, and use less painkillers, like kind of following those surgeries. They also had less fluid coming from the wound than the non-PEMF group.
And as I've already mentioned, all of these studies will be linked below and they're all on our Instagram. If you want to go check them out over there, make sure to follow us obviously while you're there to never miss any more kind of posts we put out. But going back to the kind of cancer topic, cervical cancer is one that is kind of completely unique to women. Has there been any research into that and how PEMF maybe can help with that?
Yeah, we did actually. We found a really good study that looks at PEMF therapy and how that helps treat cervical cancer specifically by boosting the immune responses and slowing the tumor growth. In this study, researchers focused on IL-37, which is a molecule involved in the immune regulation and cervical cancer progression. So this study used mouse models and it included special mice with altered IL-37. They examined tumor growth and cervical cancer death. The PEMF therapy actually lowered IL-37 levels and it triggered oxidative stress and it increased the release of inflammatory molecules like TNF and IL-6, which promoted the death of the cervical cancer cells. This study also found that IL-37 interacts with the protein coding gen, and that affects the stress and inflammation response. And as a byproduct, influences the activity of the immune cells. So, and the only other thing to mention with this study is that the co-culture experiments showed that PEMF therapy reduced the growth, spread, and invasion of cervical cancer cells. It also improved the immune cell function and inhibited the tumor growth. And again, if you want to take a deeper dive into this study, we'll link it below so you can read out, the whole thing.
Yeah, no, absolutely. They will be all linked below. And as well, so how could someone now apply PEMF for these? Is it different kind of per condition or is there kind of a general rule? How does it work?
Yeah, so I mean, this is a bit of an open-ended question because it really depends on what the person is trying to achieve. At NewMed, we offer an ability to speak to one of our team and we can give you a consultation and we can talk to people about their specific needs. But for the benefit of the podcast, I'll try and summarize this as best I can. And as I say, it really depends what you're trying to achieve with PEMF therapy. But if you want an overall system and you want to apply PEMF therapy to the majority of what women are doing and what they're trying to do for women's health, you want to try and get a full body system and, if possible, one that offers a localized applicator too. Full body PEMF therapy systems are always what I recommend as a basis model when you're looking at PEMF therapy, because it's going to work on the body as a systemic. It's going to work on everything overall. If you can improve circulation across the whole body, not just in one localized area, then you're going to accelerate those results. If you can reduce inflammation, again, across the whole body, not just in one area, then you're going to get much better results. So typically start by looking for a full body PEMF mat. You want to try and find a reputable company that does PEMF. Try and find devices that specify PEMF only, rather than these kind of multi-therapy mats we're seeing taking over the market at the moment, because they tend to do everything badly, master of none. But you want to find a device that has a good spread of the copper coils too. So as I say, if you get a full body mat, that doesn't necessarily mean you've got copper coils in the entire mat. So ask the manufacturers those questions. Does this have coverage across the entire mat? And can you use one? We always talk to people about how they're going to apply a PEMF therapy. So it's not just about going out and buying the most expensive device that you can afford. That doesn't always tend to be the best system. It's about which one you're going to implement into your life most frequently. And, you know, for me, finding a good PEMF system that is a full body system that you can roll on and off in the bed, maybe in the morning, or if you meditate, or if you do stretching in the morning, something you can do that on top of, so that you're kind of putting it into your life rather than moving your life into a PEMF system. When it comes to localized, especially with women's health, you know, a lot of the problems for women's health becomes around the pelvic region. I'm not saying that all women's health is around that area, but when looking at women's health specifically, a lot of the problems come from there. And when you're thinking about the menstrual cycle and specifically around that time when you've got menstrual cramps or you need additional assistance during that time of the month, then you want to find a good device that is going to be able to apply to that area and one that you can apply to it for slightly longer sessions. So finding a device that is portable, mobile, allows you to move away from the wall socket would be advised, and one that you can kind of like apply and move around. Naming a device, you know, the Celerate, which we always mention to people on this podcast that, you know, we do manufacture this device by NewMed in the UK. It is our device. We make it clear to everybody. But it is a good one. It is a good one that is an all-rounder device. You can have a full body system with the Celerate, and you also get the localized applicator, which is the controller too. So you can apply that in different areas of the body. You can apply it to the pelvic region. You can apply it to, you know, knees, elbows if you need assistance in those areas, and you can go about your life as normal. Looking outside of the looking outside of Celerate, maybe you want something higher intensity. Again, speak to us at NewMed. We can point you in the right direction depending on where you're from in the world. Higher intensity devices seem to be more regulated in terms of where they're sold because of the regulations. So we can tell you what's available in the UK. We can tell you where to find things in the US. Higher intensity systems tend to be more in professional settings. So you don't necessarily need to go super high intensity, super high cost, as I say, if you want to use it as a personal device. Look at something full body, look at something you know apply to a certain area of the body, and one that's going to fit into your life.
And if you want to book a consultation, I'll also leave that link below this episode, so you can book one for whenever best suits you. But while you're down there, make sure to follow us, subscribe, like, do whatever is related to your platform. And if you're on audio platforms, make sure to leave us a 5-star review. It helps us make more episodes and get bigger and better guests in the future.
As I say, between the two of us, we're not experts in women's health, but I hope this episode's been useful. As I say, if you've got any questions, leave them below and either myself or Josh will get back to you.